I've been in and out of depression for about 30 years.
Wow, that's a
Yeah.
long time.
And so I finally decided in 2010 to go on antidepressants, which is a medication to
Mhm,
help my depression.
mhm.
And the only thing I regret about going on medication is that I waited so long.
Oh, really?
Yes. I waited
Okay.
so long. I had such a problem
Mhm.
and I was suffering. I really suffered needlessly just because I believed somehow that going on medication was wrong. And, but it works so well and so cleanly on me that really the only thing I regret is waiting so long and wasting so many years before going on to medication.
Oh, okay. So you think you should have taken it earlier?
Much earlier, yeah. So in 2010, I got on Celexa,
Mhm,
which is like an antidepressant, anti anxiety.
mhm,
And then in 2011, I got on Wellbutrin, which is an antidepressant.
mhm.
And the two of them together work really, really well. I am lucky in that I didn't have to um, try a whole bunch of different medications.
Mhm,
Like these two just work. And I'm
mhm.
glad that I got put on them. So the psychiatrist that I was seeing at the time, he had mentioned about experimenting with different drugs and that there was generally a pathway to take in experimenting of which drugs may work and which ones don't. But he said that he was just going to skip me straight to Celexa because that the type of anxiety and depression that I had was really similar to other people who responded really well to Celexa. So I feel like I really lucked out in getting that psychiatrist who was able to identify that the type of anxiety depression that I had would respond well specifically to Celexa. And
Mhm,
now my most recent psychiatrist,
mhm.
she diagnosed me with obsessive compulsive disorder, OCD, and she said that Celexa is like the going treatment for OCD. And so that's actually probably what I have. I probably don't have like general anxiety disorder or GAD. I probably don't have that. It's probably OCD anxiety, and that it's being treated by the Celexa. And that's probably what the other psychiatrist was kind of picking up on, that I was like this certain type of people, probably other people who had OCD.
Oh, so you changed your therapist.
Yeah, I've had many psychiatrists. Yeah.
You changed them.
Yep.
Mm. So you don't use one all the time?
So there's the two systems. It's a therapist
Mhm,
and a psychiatrist.
mhm,
So a therapist is like the person that you talk to,
mhm,
and the psychiatrist is the person who gives you medication.
mhm. So you don't see them often?
So the therapist, generally you see them once a week
Mhm.
or every other week or
Yes,
once a month.
yes.
And the psychiatrist, you generally see once a month, or 3 months, or 6 months, or even once a year.
Oh, okay. How often do you see them?
I see my psychiatrist every 3 months or so,
Hmm.
and I see my therapist. I now see her weekly,
Mhm.
but for a while there, I had moved it to monthly
Oh.
because we really didn't have anything to talk about for a while because I was
Mm.
doing so well. So I
Mhm.
had switched it to monthly. But then I started having anxiety issues again, so I switched it back to weekly.
Mm. Okay. Do you think both psychiatrist and therapist help you a lot?
Yeah, definitely. I'm definitely a much better person from the work I've done, and I've gotten help from them. So the medication, definitely. I tried to get off the medication.
Mhm.
So I'd been on the medication since 2010,
Oh,
and
it's already over 10 years.
yeah,
Wow, I
yeah.
can't believe. Mhm.
So in 2016, I started trying to get off the medication because I wanted to conceive a child and I wanted to have the child medication free. Now, I didn't have to get off my medication because these medications are particularly safe to take while you're pregnant. But for me personally, I wanted to have a medication-free pregnancy. And so I wanted to get off all the medications. And so I got off the medications and the anxiety came back. Or rather, it turns out it was the OCD that came rearing back.
What? The OCD
Mm-hmm.
came back.
Mm-hmm.
But you were not diagnosed with OCD.
I was originally diagnosed with general anxiety disorder, but my most recent psychiatrist believes that it hasn't been general anxiety disorder, that it's been actually OCD the whole time, which would explain a lot.
Oh, okay. So you are OCD,
Yeah.
not depression.
Oh, no, I also have depression.
Oh, so both?
But the anxiety is the one that can be present every day. The OCD anxiety can be present every day. But the depression is not present every day.
Okay, so OCD stands for obsessive compulsive disorder.
Yeah.
Obsessive means you really like doing something.
It's not necessarily like. Obsessive is that it's hard to break away from a thought. And so most of my thoughts were around being forgetful, that I would forget something and I wouldn't be able to stop worrying about forgetting. And then also some other events, like one event that occurred that was most recent, and I was on my medication, but I was having just an increase of, I don't know, worry or whatever, and so then the OCD just came up. So one of the situations that came up was that I had a meeting to go to, but before the meeting, I wanted to eat. And I wanted to eat some spaghetti with red sauce, but I was wearing a white shirt. And so I started thinking, oh, I'm going to get red sauce all over my shirt. And so then I was like, no, I won't. I am going to tuck a napkin into my shirt and then I won't get red sauce on it. Ha 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 ha. But then my brain was like, you're getting red sauce all over your shirt. I'm like, no, I'm not. I have a napkin on. I'm not getting red sauce on my shirt. And then it's like, you have red sauce all over your face. Fine, I will wipe my face with the napkin. So I look down and the napkin is clean. It's perfectly white, right? And I wipe my face with the napkin and nothing comes out. I have a perfectly white napkin. But my brain still keeps telling me, you have red sauce all over your mouth. You have red sauce all over your shirt. I'm like, no, I don't. So then I look in the mirror and I'm like, see? There's no red sauce on my face. There's no red sauce on my shirt. And I walk away from the mirror and my mind goes, you didn't look clearly enough. So I was like, fine. So I go back to the mirror. Now this is the OCD because you think I have red sauce on my face and my shirt. I need to look in the mirror. So you look in the mirror and then you walk away and it tells you look in the mirror again. So then you look in the mirror again. And then I walk away and it says look in the mirror again. So then I looked in the mirror again. I looked in the mirror again 4 times.
Really?
That's OCD behavior because it kept on telling me there was something wrong and I had to check and I could not relax or calm down because it kept on telling me in my head, you have red sauce all over you, you have red sauce all over you, you have red sauce all over you. And look in the mirror. You didn't look in the mirror clearly enough. You're not seeing things clearly. You're not seeing reality clearly. If you like this, please like, subscribe, or comment.
We hope to hear from you.
Bye-bye.